Hello, my name is Dr. Sarah Mori. I'm so happy to come away from baby child and co. It's always my pleasure. I just love it when we are able to talk about the health of your children and your babies because I believe that healthy children make happy families. Have you subscribed to our channel? You should. This is the place where you are going to get reliable information about the health of your children. So you should subscribe and click on the notification button so that whenever we upload videos, you will get to know. So today I'm answering this question: what do you expect immediately after delivery? I was asked by a friend, and I'm going to talk about some of the things that you should expect in the first week of delivery. So immediately after delivery, expect that you will feel tired. You will feel relieved, but you feel tired as well. Whether you have had a vaginal delivery or a cesarean section. By the way, all deliveries are normal delivery, even if it's a cesarean section. A delivery is you have brought a baby into the world. So a delivery is a delivery, and they are all normal deliveries. Anyway, expect that you'll be tired. Also expect that your baby is going to be alert initially after the delivery for a few minutes, maybe 30-45 minutes. So you should take advantage of this period to breastfeed your baby. If you plan to breastfeed, put your baby to rest during this period. If you miss it, it may be a while, even more than a day before your baby is that alert again to interact with you. Expect that your baby is going to cry. As for babies, they cry. So you should expect it. Don't get ruffled. Don't think that because your baby is in pain or anything, babies cry. So you should expect that one as well. Immediately after delivery, your bleeding will not stop. It will change over the days and eventually stop. It's called lochia, but it won't stop. So you should stock up on your pads. Expect that your breast milk will not come in immediately. It may take 3 days, 5 days before your breasts become full with milk. Luckily, your babies after delivery, they are not so hungry anyway. The little yellowish milk that comes out, the colostrum, don't throw it away. So that one keeps them full for a long period. So you should expect that. Also expect that a baby will be more active in the night than during the day. So in the night, you are likely going to be awake feeding your baby, or you are only going to sleep for short periods because the baby will feed so much. So you should expect this. That brings me to the next point. Because your baby is going to be active during the night and feeding and all that, you should try to catch some sleep during the day. But what happens? Expect that you are going to get a lot of visitors. They are well-meaning. They mean the best for you. They are coming because they love you. Everybody is excited and happy for you that you have a new baby. Everybody just loves a new baby. They are so nice. They are so cute. They are so warm and everything. But the visitors are going to overwhelm you and they are going to tire you out. So you need to have a system in place where somebody can fence for you so that you don't get overwhelmed. And anyway, we all carry things on our hands, on our skin, in our mouth, in our nostrils anyway. So if you want to keep your baby healthy, you need to limit the number of visitors. It takes a village. We all believe that. And they are going to come. So you need help from someone who can tell them that, oh, maybe you are resting, you are tired, you just had a visitor, and so on and so forth. So that you get some time during your day when your baby is napping, and then you can also have a nap. Expect that your baby should pass the first two, the dark green one, we call it meconium. Expect that within the first 2 days, most likely within the first day, but sometimes within the first 2 days, your baby has passed meconium. That shows that his backside is open. If this hasn't happened, you should prompt your midwife or your baby's doctor or your doctor as well so that they can examine your baby for you. Expect that breastfeeding is not going to come easy. You will need to learn if it's your first baby, and the baby is also going to learn. You need to have a good latch so that you don't get cracked nipples, but it will take some time. As the days go by, the baby grows, the mouth is also bigger, and the baby just gets better at breastfeeding. But it doesn't come immediately. It doesn't come so naturally. So expect that it may be difficult. Ask for help, and you will be given. You need to have a good latch. It will help you to breastfeed well without a lot of problems. Expect that your baby may get jaundiced. We've talked about it in other videos. It's a serious issue, so you look for jaundice in your baby, and then if it happens, you prompt your midwife or your baby's healthcare provider. Expect that the urine may be reddish or brick reddish a few times in the initial days. That's just because the baby hasn't gotten very conversant with breastfeeding yet. So it clears up. So expect it when you see it, don't get alarmed. A lot of female babies, girls may have some vaginal bleed a little in the first, after the first few days, but this is just a trickle and it stops. So you can expect that as well. And don't get alarmed when you see it. There may also be some whitish vaginal discharge in the girls, and that is also normal. You should expect it. You should expect that everything has changed. You're not going to get as much time. Now you have to think about your baby. Sometimes as soon as you want to sleep, that is when your baby is going to cry. So everything is going to change. Your whole world is going to change. So you need to expect this one as well. It's a good idea to stock up on your favorite foods before you have your baby. That is supposing that your taste hasn't changed between pregnancy and delivery, because that sometimes happens. Sometimes when you're pregnant, you crave certain things. As soon as you deliver, you don't want them anymore. Expect that you are going to get a lot of advice. Now, this is funny. I mean, everybody is just going to advise you. Everybody has something to say. It's coming from a well-meaning place. Like I said, everybody's excited. Everybody's happy when you have a baby. A baby has come to the family of friends. Everybody wants to give you advice. But it is not every piece of advice that is good. So you should decide who you trust to take your pieces of advice from. If there's anything you're not sure about, you can ask your midwife, your healthcare provider, your baby's pediatrician. So you should expect that one as well. Everybody's just going to be talking to you. You need to know what to choose. You need to know what to do. It really does take a village, but yes, sometimes you need to sift through what you hear. Like I said, you're going to be tired, so you need help. You need some of the house chores to be taken over, especially if your baby has older siblings, their care and the housekeeping and so on and so forth, so that you can get some time to rest. I've talked about the tiredness already, which you should expect, so you should find help so that you don't get overly tired. Is there anything else that you would expect in the first week after delivery? You can leave it in the comment section. And then that may inspire a post. We may talk about it as well. If you have any questions as well, leave it in the comment section. And don't forget to subscribe to this channel. This is where you are going to have all the authentic information. You can also ask your questions. Have you visited our blog yet? It's called Baby Child & Co. You should visit. It's free. There are so many articles you can browse through. It's free to join the parenting club. It's free to join the community forum. Everything on there is free. So you should subscribe and you should visit our blog as well. Thank you for watching this one. This has been on a lighter note. We hope to come your way again. Bye.